Welcome to On the Beat, everyone. I'm Troy Thompson. I'm here with Amanda Fondren of Omnis Health Clinic. Today we're talking all about family care, and I mean whole family care. Welcome to the show, my friend. How are you?
I'm good.
Just remind everyone a little bit about Omnis Health Clinic and your mission statement.
Well, our goal is to take care of every patient that walks in the door and for them to be healthier when they leave than when they came in the door.
What type of services are you offering at Omnis Health Clinic?
We offer primary care. We offer acute care when somebody's just sick with a cold or an upper respiratory infection. We offer bioidentical hormone replacement. We also offer some other therapies that are not around here in this area, like
I love that.
Evox therapy, which would be a whole nother
Conversation.
Right.
Well, we have lots to talk about. I want to talk a little bit about whole family medicine, if we can. When that word gets thrown around, that statement, whole family care, what does that mean?
For me, that means taking care of multiple generations of the same family. I, as a provider, since the beginning of my career, I have attracted whole families where I see the parents and then the children and the grandchildren and even great-grandchildren at sometimes. And you can see things in the children and grandchildren that you need to prevent as far as medical problems and disease.
Well, and that's what I wanted to ask you, to be honest with you. Why is it so important that you're seeing multi-generations within the family? Does that help for long-term care?
I feel like it absolutely does, because I can pinpoint things that if a kid is going to their pediatrician, the pediatrician doesn't realize that the grandparents and the parents have a history of this coming down the pipeline. A good instance of that is kidney stones. When you see a teenager with kidney stones, did their dad have kidney stones? Did their grandfather or their grandmother have kidney stones? What can we do earlier in life to help their health be better, because we know their parents and grandparents have a condition? Okay,
that's interesting you say that, but let's just say does something skips a generation. Okay, let's just say diabetes. We'll just throw that out there, that my grandmother died of complications of diabetes, but both my parents didn't have that, but all of a sudden I'm 16 or 17 and you're now my physician and I see that happening. Why is that so important that it skips a generation, but yet you've picked it up and you can now track that through the family?
Being aware of things that occur in family lines just helps you be more in tune with picking up on symptoms and causes of symptoms, even in the younger generations. While it's not super common to have a disease in a child that a grandparent but the parents didn't have, it happens. So it helps your brain tune into that as a provider.
Well, I think you're looking at the whole picture, aren't you, really?
You are. I am.
You're having a much clearer perspective on from every generation that comes through the door. And one of the best things about that is grandparents have great knowledge.
They do.
We forget about them sometimes, right? And it's important to have their knowledge talking to you about what's going on with their kids as well.
Right.
I want to just remind everyone, you said something to me last time about what you value about doing what it is that you do and what you want people to experience when they come in.
I want them to feel loved and well cared for. And I want them to feel better when they leave than when they got there.
I think that's fantastic. Thank you. We appreciate you.
Thank you.
If you want to find out more information, there it all is up on the screen for you. We're talking all about Omnis Health Clinic and, of course, with the owner, Amanda Fondren. Back after this short break.